Hello, my name is Jordan Pace. I'm an occupational therapist at St Anne's. I'm currently taking part in the occupational therapy rotation, which means I get to spend 6 months ward to ward before moving on to the next one in my rotation. I felt there was a gap in the service provided when it came to the topic of addiction, particularly substance and alcohol addiction, as service users frequently are admitted or readmitted into hospital after a relapse of using drugs or alcohol. When on Harbour Ward, I developed a group in which patients could talk freely about their substance and alcohol use without feeling like they were going to be judged or reprimanded. The group was made through an occupational therapy lens, which encouraged both patients and staff to think about addiction as a meaningful occupation, one that might not necessarily be good for health and well-being, but holds a lot of value for the individual nonetheless. Patients are encouraged to engage in open discussion about both the positive and the negative effects of drugs and alcohol. As well as this, we're able to educate patients on the causes of addiction, what kind of raises the propensity for addiction, as well as the biological, psychological and physiological changes it makes to our bodies and systems. So far, the group formulation is taking place on Harbour Ward, in Nightingale House Rehabilitation Unit, CV Ward, the admissions unit where I am currently posted in rotation, as well as Haven PQ Ward. QI have really helped in being able to maintain focus on the group, as well as helping me to gather the information and the data and the statistics I need to eventually be able to write the group up and evaluate the effectiveness of it on each individual ward. They've also helped me think about how I can consolidate a pathway for substance and alcohol use from admission into St Anne's through to a treatment ward and eventually into discharge.